The standard treatment that we would use prior to having intraoperative radiation would be a woman would come in day one for a lumpectomy and a lymph node biopsy. That's usually an outpatient surgery, so she'd have her surgery, she would recover from her surgery, she'd heal her wounds for about a month, and then she would start 6 to 7 weeks of whole breast radiation.
What's entirely different now and what we're going to offer is that for some women, they'll have the capability of having that 7 weeks reduced down to 1 day. And that 1 day will be in the OR at the time of lumpectomy. Not only are we reducing the time, we're also reducing the treatments to normal tissue. And that treatment includes the skin, the chest wall, the muscles underneath, the lung, the heart, and anywhere else photons can travel while we're treating from the outside. And I think that's the key for women. Minimize their normal tissue injury and get them home as quickly as possible.
So we would do the lumpectomy surgery in a very traditional way. And once the cancer's been removed, we bring in the linear accelerator machine right into the operating room while the patient's asleep on the table. We bring the electron device right into the surgery and we deliver the radiation into the wound where the cancer was. That treatment takes 2 minutes and it's directing radiation treatment right at the lumpectomy site.
Main cosmetic benefit is that we're not going through the skin. So the radiation is delivered directly to the surgical cavity. That means no skin changes for women, no fibrosis or scarring, no hardening of the skin or the tissue underneath it, and the appearance is just as if you've had that lumpectomy with that small scar, and that's it.
The patients we're going to be using this new treatment on are women over the age of 60 with breast cancers less than 2 centimeters in size. We're aiming to use this in women that don't have any lymph node spread, and the cancer should be estrogen receptor positive.
For all the other women, less than 60, who may not have all the same good features, they can still receive a portion of their radiation in the operating room. So if you have at least a portion of it in the operating room, you're minimizing 2 to 3 weeks of that 7-week course that you'll need on the outside. So you'll only need about maybe 4 to 5 weeks of radiation. And they'll be spared that extra boost dose from the outside of the skin. So the cosmetic outcome will be better even for them.
This is really cutting edge technology, state-of-the-art technology. There's very few centers in this country using this technology. This really takes Jupiter Medical Center to the forefront in terms of the treatment of breast cancer. We are able to offer really world-class radiation treatment.
This is very exciting. There are very few places in the US that are doing this. I'm glad that this has now become an acceptable form of treatment. It's been done in Europe for the past 12 to 15 years. The Institute in Milan, where we went to train, has treated over 8,300 women with excellent results. And we're excited to be one of the few people here in this region and in the country doing it.